Well, hey everybody, this is Robert and welcome to Outbreak News TV. And in today's video, I want to take a look at the COVID-19 situation in Africa. Now, I previously predicted that there would be real massive spread in places like Brazil, India, and also Africa. But thus far, Africa has been, as a continent, relatively subdued. But let's take a look at what's going on the African continent. And this is from the World Health Organization African region and their Twitter page. And it says over 110,900 confirmed COVID-19 cases on the African continent, with more than 44,500 recoveries and 3,300 fatalities. And this total, almost 111,000 confirmed cases, includes the World Health Organization African region and also the World Health Organization Eastern Mediterranean region, the African countries that are in that region, like Egypt and Morocco and Sudan. So that gives us a total of almost 111,000 cases to date. Now, this is actually a COVID report from the WHO African region that's about a week old. It was from May 19th, but it has some important information on it. The numbers are not timely, but it does have some other important information. And just to give you a little background, the coronavirus disease 2019 outbreak continues to advance in the WHO African region since the first case was first reported February 25th in Algeria. Now, confirmed cases of COVID-19 have now been recorded in all 47 member states in the WHO African region. I think they had, the last country was Lesotho that got a couple cases within the past week or so. Confirmed cases, while there are many variations among countries, the overall numbers of reported cases and deaths have been increasing exponentially in recent weeks. And more than half the countries in the region are experiencing community transmission. There's also increasing incidence of cross-border transmission of COVID-19 between countries in the continent, mainly through long-distance truck drivers and illegal movement through porous borders. And you can see that some of these countries have seen very dramatic increases in cases from the period of May 13 to May 19th. Mauritania, over 1,500% increase. Central African Republic, 90% increase. Uganda, 106% increase. So yeah, you can see the numbers are really increasing dramatically in a lot of these countries. And other information I wanted to get from this is the highest caseload has been observed in the West African region. That's accounted for about 40%, followed by Southern African region, 27%, and North Africa at about 9%. They also mention of concern is health workers who have been greatly affected by COVID-19. And as of May 19th, almost 2,000 health workers have been affected in 32 countries since the beginning of the outbreak. So that's been an issue. So all in all, it's something that we have to keep an eye on, because not sure about how well the testing is going on there. And Africa have some of the most dense populated cities in the world. Lagos, for example, is actually a great example. And so we got to keep a close eye on what's going on over there. And plus, these populations, there's a lot of poverty, malnutrition. They're also battling a number of other infectious diseases. Look at the Democratic Republic of the Congo, battling half a dozen or more outbreaks at one time. So we got to keep a close eye on Africa. And this is from a CNN report, and it says here, during a briefing on Friday, Dr. Mike Ryan, the World Health Organization Executive Director of Health Emergencies Program, said, quote, "On the one hand, good news. The disease hasn't taken off in a fast trajectory. But there's a concern some countries are accelerating in the number of cases. Ryan said within Africa there are many, many highly vulnerable groups, and the bearing of coronavirus in these groups has yet to be seen. Quote, "We don't know what the impact of this will be in undernourished children with chronic malnutrition. We don't know what the impact will be in the overcrowded refugee camps. So there's a lot still to be learned," he said. Africa's lower mortality rate could be partly because of Africa is the youngest continent demographically, with more than 60% of the population under the age of 25. And last thing I wanted to mention from this article is a new modeling study by World Health Organization predicts that if containment measures fail, even with a low number of cases requiring hospitalization than elsewhere, the medical capacity in much of Africa would be overwhelmed. So, again, these are some of the things I mentioned in the intro. Is there's a lot of things to keep your eye on because there's a lot of things that can go very, very wrong on this continent. And let's go ahead and take a look at some specific countries and how some of the more heavily affected countries. And South Africa has reported the most. Not clear if that's because they have the greatest testing capability, but they have, as of Sunday, 22,583 cases. Western Cape province accounts for about 2/3 of all the cases in the country. Other provinces reporting a lot of cases include Eastern Cape, Gauteng, and KwaZulu-Natal. So a lot of cases going on in those provinces. There's been over 500,000 COVID tests conducted so far, and they did about 19,000 in the past 24-hour testing cycle. Now, fortunately for South Africa, their fatality rate is relatively low, and they've only reported 429 deaths to date. So, another country I want to take a look at is Egypt. Egypt is reporting one of the higher amounts of higher amounts of cases in Africa. And on Sunday, they reported a single-day record of fatalities with 29. So their death toll in Egypt now is 764. The total case number, they saw another 752 cases Sunday, and their case number is 17,265. So on the continent, they have seen the second most cases. And of course, Egypt being a heavily Muslim country, there's a lot of concerns right now with the holiday season, the Eid holiday season. So we'll be keeping a close eye on Egypt in coming weeks. Now, the country to report the first case in Africa was Algeria. And according to their Ministry of Health, they saw another 193 new confirmed cases on Sunday. And they now have over 8,300 cases and 600 fatalities in the country. And let's see if they get any other. And that's it. That's very, very brief report from the Algerian Ministry of Health, computer translated. And let me go ahead and close with the most populous country, which is Nigeria. And as of Monday morning, today, at 9:30, they've had 7,839 confirmed cases, 226 fatalities. So on Sunday, they saw over 300 new cases and 5 fatalities. And when you take a look at the states in Nigeria, Lagos State is reporting by far the most with over 3,500, followed by Kano, and it keeps on going. So Nigeria hasn't been hit nearly as hard as I expected. I expected Lagos to really light up like a tinderbox, but it hasn't. So, good work in Nigeria. But we'll definitely be keeping a close eye on large cities, large, densely populated cities like Lagos, like Kinshasa, like Cairo, and other cities like that on the African continent. Anyway, that's just a brief overview of what's going on in Africa as far as the coronavirus disease 2019, and definitely a place to keep our eye on. We've seen other areas of the world Took a little while, but they're really picking up pace. Brazil, something I always was expecting, is now number 2 in the world in cases. Keep an eye on India. The cases are accelerating in that country too. And probably it's important to keep an eye on the whole Indian subcontinent, Bangladesh, and some of the surrounding countries. Anyway, I hope you liked what you saw. Please comment below. Let me know what you think. Subscribe to the channel. Share it with your friends. And I'll see you next time on Outbreak News TV.